a great question this week. The question was, why are we talking so much about falls? As many of you know, we have started a push to help educate the 52 million people that are living with hearing loss. They are at a significantly increased risk of falling. As in a recent focus group we put together, we learned that falling was the second highest common concern for older adults right after developing dementia. Giving the connections between hearing loss, dizziness, feelings of off balance, and falling, we have the opportunity to, or perhaps it's an ethical obligation, to talk to our patients about their increased risk of falling because of their hearing loss. I'm going to explain a few things that we all need to know in hearing healthcare. Okay, number one, falls are the number one cause of injury-related deaths in older adults. Falling can lead to a lack of independence. Falling once makes it more likely that you will fall again. And falling costs the average U.S. family about $30,000 per incident. So, in case you were wondering, what does that have to do with hearing loss? Well, we know that for every degree of hearing loss, a person's risk of falling increases another 140%. You heard that right. For every degree of hearing loss, a person's risk of falling increases another 140%. And studies have shown that the medical treatment of hearing loss may nearly eradicate this increased risk. So we in the hearing healthcare play a tremendous role in helping people to stay upright. In the past 10 years, it is estimated that 7 people per hour will die of a fall. And if an older adult falls and they are lucky enough to survive that fall, can lead to taking away their dignity, their independence, and that can be just as traumatic because that can lead to anger, stress, guilt, and depression, and a decrease in the quality of their life. Now, there are 5 medical benefits of the early treatment of hearing loss. So, number 1, the increase of quality of life. Number 2, the decreased experience in tinnitus. Number 3, the increase of cognitive function. Number 4, the decreased risk of developing dementia. And number 5, the decreased risk of falling. If you haven't done so already, I want you to read the Falls White Paper. So do your research and educate yourself on hearing loss and other steps that can be taken to reduce the risk of falling. Thank you and take care.